Hi. Hi, I'm Amanda. Nice to meet you.
Nice to meet you all. Thank you all for coming. I hope it wasn't too hard of a class with the rain. Yeah.
All good.
Okay, awesome. What time are we starting?
I think like
In 5 minutes? Oh, 6:10 now? Okay, and do you have the script?
Yeah, so the script is on the podium.
Oh, okay.
Yeah. Okay, does everyone have one? I brought some extras.
After I hand it over to you.
Yeah. And also, so if it's okay, we can just like. I was talking. Yeah, I think the Zoom.
Is this your stuff?
Yeah.
Okay. Yeah.
Cardigan. I knew how much. Yeah, we do. I think I feel confident that we get the healthcare questions out and then, yeah. Are you, well, he's here. Doesn't matter. Your name tag. Double opportunity to know your name. How did you get that one?
I'm good.
Okay.
We're gonna go ahead and start. Sorry for the delay. We were just hoping to get more people to come through just because of the rain and all of the messy traffic outside. I hope everyone's well tonight. Can everyone hear me? I'm not really using the mic, but are we good in the back? Yeah, okay. Good evening and welcome to CAPAL's Washington Leadership Program. My name is Shama Ahmed and I'm the Managing Director at CAPAL. At CAPAL, we cultivate Asian American, Native Hawaiian, and Pacific Islander public service leaders by providing formative professional experiences and growth opportunities. This includes our annual public service scholarship and internship program. It also includes a lot of supplemental programming that we offer all summer long to our cohort, which includes the roundtable series, a mentorship program, and also CAPAL's signature Washington Leadership Program, which is session 3 tonight, and it runs every Wednesday evening throughout the summer. Our 2025 WLP series was pulled together by a group of alumni, so scholars and interns from previous years come together to support, and they work several months with our staff to create and plan this summer series. So for tonight's session, we're excited to welcome you to our panel discussion tonight. Our topic is public policy in the AANHPI community. Will revolve around various public policy topics such as economics, immigration, healthcare, and the impact of it on the AANHPI community. There will be an audience survey. I feel like some of you are already familiar with that. So before we close out at the end, we'll have you fill out a survey. It's super important that you all provide us feedback. It directly impacts our programming. And we encourage you to follow and join our conversation tonight on social media using the hashtag #WeAreCAPAL. Thank you to all of our speakers and panelists this evening for spending their time with us and to all of you for joining us. Also, a very special thank you to our 2025 WLP sponsor, the DC Mayor's Office on AAPI Affairs, MOAPIA, for making programs like tonight's possible for CAPAL, and a special thank you to API Vote for hosting us tonight. Before I hand it over to June, I will ask what API Vote staff to come and say a few words, and then we'll go right into the program.
So thank you. Hey everyone, super grateful to meet you all and be here. My name is Karina Salvi, pronouns she, her, hers. I work with API Vote as, oh, can you hear?
Oh, I was just going, yay.
But yeah, super grateful to be here. And for those that don't know a little bit about API Vote stands for Asian Pacific Islander American Vote. I believe I saw almost all of you at the intermixture that we hosted yesterday, which was a super success. And part of API Vote's mission, right, is not just doing voter engagement, but amplifying civic engagement and amplifying the issues that our population faces across the US, right? So if you're ever interested or want to chat more, although I think I'm probably talking to probably 3/4 of the room over the summer. Yeah, I'm just super grateful and very excited to see this space being used. I think Christine would love for me to share one last thing, which is the purpose of this whole office is for it to be a space for our community. So for you all, as well as the speakers and panelists coming here today, feel free to come into the space to do work. We have focus rooms in the back and such, and yeah, see it as a home for us, right? Yeah.
Also, there's going to be like a ad for the API collective space up in the website soon, so any organizations want to like rent out the room so that they can actually go there, so it's like a plug.
Yes, and I think the last announcement I have before I kick it off to you all is we will be hosting a congressional reception, I believe July 8th. July 8th or July 9th. So if you have any more questions about that, we'll probably all receive an email, but super excited.
And just, so usually we have WLPs on Wednesday evenings, but because we have the congressional reception, we will be swapping dates. So the next WLP will be July 10th on a Thursday evening, and you'll all be invited to the congressional reception on the Wednesday night. And I will go ahead and hand it over to June, our lovely moderator for this evening.
Thank you. So hi, everyone. I'll be very real with you. We are starting a little late and we do have a couple panelists who need to leave a little sooner. So I will be shifting things along, but and I would like to introduce the panelists myself to start off so that way we can go into the questions. So again, my name is June Gao. I work at AARP as a senior audience strategy lead within the Office of Diversity, Equity, and Inclusion. A little side note, I'm not a public policy expert, but I did work within AARP public policy with family caregiving and helping them engage in the execution of some of the recommendations that came from public policy. So I'll chime in with a little background in that. And so to introduce my panelists, I will start with Sherry Daniels, who is the CEO of Papa'ola Lokahi, Amanda Yuen, a legislative correspondent of Representative Judy Chu's office, Rita Kuwahara, who is a senior advisor for medicine and health policy of the Association of Asian Pacific Community Health Organizations, Kevin Loom, Director of Federal Policy Staff at AAPI Hague. And before I start into, and I'll remind everyone of this resource as well before I get into the panel. Public policy is a very, very big topic. And so I know in the description, we were going to try to cover at least 4 of them, but to go into the breadth and depth of it, I wanted to share this resource, which is from the National Council of Asian Pacific Americans. This 100-day review for AANHPI communities. It's been 150 days this day since the inauguration, but this document is still very, very relevant. It covers a lot of the history of where our public policies might stem from, as well as what the current situation might be in terms of the recommendations. So this is on ncapaonline.org, but afterwards I'll be sure to reshare this as well as have this in the email that's sent out to participants. So let's get started. Our first question would be, could you share a bit about your work in your organization and how it's impacting the AANHPI community? And then what are those key moments that led you to where you are sitting or where you are today? And so I'll start off with Rita.
Hi, everyone. So I'm Rita Kawahara with APCHO, the Association of Asian Pacific Community Health Organizations. I'm actually a primary care internal medicine physician by training, but serve as their senior advisor for medicine and health policy. And right now there are a number of attacks on the political side, both on health, public health, and also immigrant families. So the work that we're doing is to address we'll first hold the line and make sure that all of our communities have access to care when they need it, and that it is affordable and accessible to everyone. But to get to your question about how I came to where I am today, I actually knew for a really long time, like when I was in high school and middle school, that I wanted to go into medicine, but was really interested in policy and social determinants of health as well. And I decided to go to Wellesley College for my undergraduate degree because they had a peace and justice studies program, and you could create your own concentration. So I created my own concentration in the inequities in the healthcare system in the US and abroad. And knew I wanted to do medicine, so did all the requirements for medical school, but did grad school first in international health and health policy, so that I could explore some of the global health issues, and then went on, did medical school. But in medical school, while I was learning clinical medicine, I also was very interested in policy and some of the, to get more directly involved in the legislative process. And so I was a part of the national leadership with the American Medical Student Association, which is a fully run student-led group for medical students and tends to be a very progressive group as well. And I would come to DC probably once a month, meeting with my congressional offices and engage from the clinical side, but also did advocacy training for medical school students across the country, and was really involved in that. And then also was involved with, I knew I wanted to do internal medicine, so was involved with the American College of Physicians, which is the professional medical society for internal medicine physicians, and ended up serving as their medical student intern during my medical school time in medical school. So I was in DC working more directly in policy. And then after that, I did my intern year, my clinical intern year, and then had an opportunity between my intern year and the rest of residency to come to DC for a year with APCHO, where I am right now also. But at that time I was a fellow working on hepatitis B policy, and really got engaged and was able to do a few critical things at that point. This is 2017 to 2018. So there was hepatitis B disproportionately affects the AA and AANHPI communities, but we tied that to the rising cases in acute hepatitis B and the opioid epidemic. And so we were able to create a new program at the Centers for Disease Control and Prevention to address opioid-related infectious diseases, and then also laid some of the groundwork that resulted in changing the clinical guidelines so that now we have universal adult hepatitis B vaccination in addition to universal childhood vaccination. So that was, and then I went back to do residency. That was during COVID. It was a very different experience, and staffing the COVID wards and ICUs made it more apparent why it's important to engage in policy. So then I came back to DC for my clinical fellowship at Georgetown, and was at the time also a fellow at the Center for Medicare and Medicaid Innovation. But then after that was an APACS fellow on the Hill, so I could work directly on some of the legislative legislation through that lens, and then was on the Hill for a couple of years, and recently transitioned off, well, not that recently, but last year transitioned back to APCHO. So had a kind of circuitous path, but kind of knew that I wanted to do medicine and health policy and bringing it together. So I will have to leave shortly, but June has my contact information, and she can share it with all of you, but I'm still here for other questions.
And I'll pass it to Sherry.
Velina Mai Kako, aloha. Sorry about my voice. I don't know what's the raspiness going on. But thank you for letting me join you. And I feel like I'm a fly on the wall, kind of listening to the other panelists talk about, I think, policy kind of broadly. And I wanted to kind of start off with policy is not politics, and politics is not policy. And I think that's something we got to continually remind ourselves, that it's so easy to get caught up in the politics that's happening around us, but to do good policy work It's not about politics. And so I'm just gonna leave that. And I think to answer the other question about like how we got here, so Papa'ololokahi is the Native Hawaiian Health Board, and we oversee health for Native Hawaiians across all 50 states in Hawaii, but also outside. And we do that because we oversee the Native Hawaiian Health Care Improvement Act, which is a codified federal law specific for Hawaiian health. I don't think many people know that there are 3 acts specifically to Native Hawaiians. And the health one, as I mentioned, the Native Hawaiian Health Care Improvement Act. We have our housing, which is our Department of Hawaiian Homelands, which is our Housing Commission Act, as well as our Native Hawaiian Education Act. So I think for us, we kind of have very different trust responsibility in terms of Native Hawaiians than some of our other counterparts. We also are in considered Native American, so we also are in that same grouping as American Indian and Alaska Native. So we do fall under that federal recognition or that federal descriptive of Native American, which makes our policy work slightly different because it's about reminding about trust responsibility. And our trust responsibility looks a lot different than American Indians or tribes. But there is still a definite trust responsibility to Native Hawaiians. My road wasn't as winding as Rita's was. I think I knew I wanted to help my community because we struggled with a lot of things. And today, right, there are all the health disparities, which I think, and this is just my soapbox, I think one of the challenges is it's so easy to show how disparate we are, but as a community and as a culture, we're quite resilient. And so we need to really look at policy and how we change the narrative so that when we talk about our generational work, that we're talking about the resiliency that we bring, and that resiliency isn't a surprise, that we come from a place of resiliency. And so I knew that's what I wanted to do, was help our community. And so I have an opportunity to, I don't know, share space with some pretty awesome people, uphold my responsibility, my kuleana to my ancestors, to my community, to our lahui. And so it's not about me individually, but it's about the collective. And I believe others on the panel have that same philosophy, that it's not a me, it's a we. And I think that's, I'm just going to leave it at that and pass it back to the panel.
And thank you, Sherry, for really putting forth the policy is not politics remark, because it is about the people. And so I, did a quick Google definition and it came back as public policy is a set of actions the government takes to address issues within society. And society is where we as the people are. And so thank you, Sherry, for bringing that home. And then, so Rita, I know it's time for you to depart, but again, Rita, did we?
Maybe like 3 more
Oh,
minutes.
3 more
or so,
minutes?
in case
Okay.
There's another question. I know that we haven't done
Okay.
all the panelists, but if there's one.
Is it okay if I
Of course.
throw another healthcare question out? Okay, so when it comes to the widening health disparities around the country, and it's how it affects the API or AANHPI community specifically, do you see any silver linings, or like how do we move forward from this, especially with a lot of the movement of, certain areas of work that we thought was moving forward and might be moving back, but what is something that you in particular have seen that you could say there's a silver lining, or how do we go forward?
Yeah, so I mean, I think that in the last administration, we were making a lot of strides forward, looking at data disaggregation, trying to dispel the model minority myth in the Asian American, Native Hawaiian, Pacific Islander communities. Right now, we have to be very careful about what we're doing in terms of data collection. First of all, it's not a priority of the administration, but secondly, at the community health center level, because APTO represents community health centers across the country, caring for Asian American, Native Hawaiian, Pacific Islander communities. But what happens is that, like, we don't want to be collecting any data on immigration status or some of the disaggregated data that we were doing before, because it can actually be weaponized against our communities. And so But being aware of that is one thing, which is frustrating. However, I feel like on the clinical side, a lot of the disparities in health that we see in the AA and NHPI communities are not necessarily known by clinicians or the community more broadly. And while we absolutely need more data, we need to have a better sense of what's happening. We already have some information that we could right now use to highlight some issues. And I'll give a couple of examples. Diabetes disproportionately affects the AA and NHPI communities. It's estimated that about half of Asian American, Native Hawaiian, Pacific Islanders who have diabetes are not aware that they have diabetes. And that's because the World Health Organization says that to be considered overweight in the Asian American community, you would have a BMI of 23 rather than 25, which is what's commonly used in the US. A few years ago, the diabetes screening guidelines changed. So they said that anyone who is overweight or obese at the age of 35 years or older should be screened for diabetes. But for the Asian American community, what ends up happening is you have people who are in that BMI of 23 to 25 who are normal weight according to US guidelines, who actually would be considered overweight by international standards and are at higher risk of having diabetes, and they're not being screened for diabetes. So increasing awareness in our communities and among clinicians that, oh, we should be screening for diabetes at a BMI of 23 is one example. Another example is around maternal mortality. The Black maternal mortality rate is unacceptably high, but actually the highest maternal mortality rate is in the Native Hawaiian Pacific Islander communities. But that was only shown in data from 2017 to 2019 by the CDC because they aggregated 3 years of data. So they had enough numbers, raw numbers in the NHPI community to show that the rate of maternal mortality was 50% higher in the NHPI community compared to the Black maternal mortality rate. And then in subsequent years, they've left out the NHPI category completely because the numbers are too small. They're only reporting 1 year of data at a time. So if we are aware that we've seen this in the past, taking data that's there, even if the CDC isn't reporting it, but then if we have access to raw data, being able to put some of this data together to show that this is an issue or to highlight these issues, I think that is important as well. And so even if we are taking steps backward or trying to protect like patient privacy, the data and patient privacy and all of that, we already have information that we can use to improve AA and NHPI health and reduce the disparities that we're seeing.
You.
I think I do have to run now.
Yes.
But thank you for having me. June has my contact information. I am happy to just feel free to reach out and would be happy to answer any questions, set up like Zoom calls, you know, other sorts of things if anyone has follow up.
Yeah, so any of you who might be inspiring doctors, public health practitioners, or anyone who's interested in working on the Hill, Rita is a wealth of knowledge and experiences that you might, you know, be interested in chatting with her about. So afterwards, please follow up and come to the table to see how you can get her contact information. Thank you, Rita. All right. And so, Sherry, I know you have probably an answer to that question, but before we get back to the healthcare conversation, I do want to finish up with our panel, Kelvin and Amanda, to finish up introducing themselves and their area of work, as well as why, like, how'd you get here? So,
yeah, I can take that. So,
Yeah.
Kelvin Lum, Director of Federal Policy at Stop API Hate. I've been there for 3 months. Previously to that was spent 12 years on the Hill working for Congressman Amidera from Sacramento. Started as an intern in his office and left after 6 years of being his legislative director. Stop API Hate turned 5 years old early this year, born out of the pandemic, seeing the rise of anti-Asian hate because of COVID-19. And so core to the work is addressing anti-Asian hate. We have the largest reporting center of anti-Asian hate incidents. Since 2020, when that started, we've seen almost 13,000 incidents reported to our reporting center. But building off of that, we're doing more work in immigration, really tying the anti-immigrant sentiment and actions out of this administration and the Republican Congress to anti-Asian hate as a form of anti-Asian hate. And getting to some other policy areas. How I ended up here, I actually grew up in the DC area. So both my parents worked for the federal government. I have a lot of public servants in my family. My brother's a teacher. So This is my way to kind of continue on the public service dream. And so, yeah, we were taught growing up to find ways to give back, and so this is my way to give back.
Amanda?
Yeah, I'm Amanda Ewan. I worked for Congresswoman Judy Chu as her legislative correspondent. She represents California's 28th district, so it's Pasadena, Alhambra, Monterey Park, the 626, if anyone is from California or Southern California. I am also myself born and raised in Los Angeles, so it's really special both to work for a California rep and also being Chinese and Taiwanese American myself, work for the first Chinese American woman elected to Congress. I cover her agriculture portfolio, her consumer protection, but most relevant to this conversation, I cover her Asian American portfolio or AANHPI portfolio, as well as her civil rights portfolio. Not a lot of members of Congress have an AANHPI portfolio, so it is also incredibly special to be able to work for her and do that work, especially since our district has a little over 30% is Asian American, and also it's the fourth largest. It has like the fourth most populous Asian American population by congressional district. So it's also work that the Congresswoman herself has been leading for a long time as former chair of the Congressional Asian Pacific American Caucus for close to 14 years. So feel really lucky to be in that. How I ended up there, when I was in college, I was interning for a bunch of different organizations, doing a combination of direct services work, so working directly with refugees to help them get their green cards or naturalize, and then also doing more public policy focused work from advocacy organization side. One of those organizations was with the National Domestic Workers Alliance, which I actually was a CAPAL scholar, and so CAPAL helped fund that internship for them, so very grateful to be here, particularly for that. But going to school in Baltimore, knew that I wanted the opportunity to intern on the Hill. Was able to get an internship with the late Senator Dianne Feinstein, who's also from my home state of California. And if you will, got bit by the bug, really fell in love with the work, found a lot of like purpose, power, and just enjoyment in the community of other people, like Cohen was saying, who are working to represent our home state and make life a little bit better from those that have come before us. Something that sticks out to me that a mentor of mine said very early on in my career is we're building a world that we've never built before, as in a world where our community's voices are at the table, because that's not something that when the founders started our country, they weren't imagining a room full of people that looked like us necessarily. So that's kind of the mantra that I carry with me as I do my work now in Congresswoman Chu's office.
So after hearing our panelists talk, I now am aware that not only am I not the policy expert here, but my journey towards public service was, I did not think I would be in public service, but it sounds like all of you had actually had that initial start. Just to give a bit of background, I grew up in New Jersey to Taiwanese parents who immigrated over here, and I'm the eldest daughter of 4. And as the eldest, they had great plans for you. They're like, you got to set example for your sisters, right? You got to, straight A's, be a good student, go to college, become a doctor, engineer, or accountant or lawyer. And by the time I got to college, that's when my love to help people. So that was something I think we all have a thread in. My love to help people, I thought was through, becoming a doctor. After getting on the college campus and putting a lot of my time actually in the clubs and organizations, and then 4 years later, I'm like the president of like 4 organizations. Through that experience, knew that was something I enjoyed. And through different internships in DC, I actually found out that, you actually can get paid. And so when I finally told my mom I didn't take the MCATs, I am not applying to med school, maybe I'll take a gap year. And she's like, okay, what are you gonna do? I was like, nonprofit. And she's like, you're not, no money, what? And I was like, maybe, I don't know. Like, give me this opportunity to go to DC again for another internship, see what I can get as a job. And so funny enough, when I did get that job offer, I told my mom how much I was making, and honestly, it's really not that much. But she was like, oh, thank God you can like survive. You're making more than your dad did. And I was like, oh wow. Like now in retrospect, I'm like, my parents were not, they did what they could. And so that was something like I look in retrospect and appreciate. But just wanted to kind of share that because I believe many of you probably in this room also have this connection to wanting to help community. And whether it's through public service, whether it's, working in the private sector, I think that's still something that ties us all together. And then Sherry, going back to the healthcare question, and I really wanted to bring out, so at AARP, I also get to work on the American Indian Alaska Native community and audience strategy. And so something I've worked on with my community partners is trying to navigate what the beginning of this year had looked like in terms of their certainty and their capacity to continue the great work that they have going on for the rest of the year. Many things have shifted, many things, pivoted, and I'm sure you have stories of what might have occurred for you during these past couple of months. So if you can kind of share a bit about that, as well as any other policies that you had to pivot.
I think the landscape, we're all very familiar. I mean, you'd have to be living under a rock to not know what is happening, whether you're, social media or just the regular news. It's all around. So I think everybody not have to, but has to really re-examine the strategies in which they take to achieve certain goals, certain outcomes for your community. And not just your community, right? But the greater well-being of our people, of humans, right? That at the end of the day, I don't think any of us would not serve or support anyone who needed help, whether it's better understanding of what's going on, of accessing whatever they need. But I don't think any of us would say, no, that's not important to me. But we have to really re-examine the strategy in which we do these things now. Because I think, as Rita stated, right, it's not safe. And safety is kind of, what I consider safe might not be what you folks consider safe. But so it's like determining with not only your organization, but your community, where is the boundaries that you're willing to work in? How far are you going to push to stay on top of things? Because there's some spaces that you cannot push. And so, one of the things with public policy is what is the strategy that we're going to take in order to get to the outcome? And I don't know if we really recognize that maybe at the end of the day, we all want the same outcome. We all want a thriving community, whatever that community you associate with, whether it's your Chinese American community from San Francisco, it could be the dance group that you've been dancing with for the last couple of years. It could be the neighbors in your neighborhood that you grew up with. So community varies depending on what we're talking about and who you're talking with. But I don't think anyone on either side of the aisle is not for improving their community, whatever their community looks like. And I think that's what we got to recognize is we all have a different picture of what community is. And what we have to figure out is what is the strategy that Sherry's going to take, but not just Sherry, but what is the strategy that Papa Ololokahi is going to take? And am I in this role able to align myself to that strategy to reach the outcome? And I think that's something a lot of people don't do because we get caught up in the passion and in, right, that fight for a lot of things, especially when we talk about communities that fought to get here, to have a better life. Those kinds of things involve a lot of passion. And when you mix passion with things, sometimes that fogs the glass of strategy. And so I think that's something for me I've had to really stop and pause a lot of is, okay, wait, am I doing this because it's the right thing to do, but it's right by who? Because it's easy and maybe I'm not going to get caught in a crossfire, or is it the right thing to do? And it's going to suck for me because I'm going to have to stand up and maybe stand up alone to stand in my truth, to be honest. I think those are kind of the spaces we're in today. We weren't in there a few several months ago. Although, and I'm just going to throw this out. I think complacency is something that we cannot tolerate either. So as great and maybe as easier 6 months ago to get things through, to have conversations about data disaggregation or about immigration or about how we are creating equity in spaces. I think we got to look at sometimes when we get complacent and things get easy, we forget to keep our tools sharp. And so that's, I think, something I have really learned during the last, I mean, it's what, 6 months, not even 6 months yet, is that we gotta keep our tools sharp. And tools could be the resources, your relationships with folks, your understanding of bipartisan relationships, all of those things. So in our community, we have this season, this period of Makahiki, which is a period in November through February, where culturally it is a time of regrouping, of resting, of you know, taking the time to refix your nets because you need that to go fish. It's a time to sharpen your tools. It's a time to prepare. And I think we don't do that. We're constantly on the move. We're constantly, right, checking off the boxes. But I think there's something to be said about taking thoughtful pauses to reassess and realign. I think we go at 100 miles an hour and we kind of are building the plane as we fly it. And that's fine in certain cases. But when we're talking about people and people's passion, I think sometimes we gotta take a pause. And that's something this last 6 months has taught me that it's great when it's easy. But when it's easy, we stop realizing that we need to be prepared when it's hard.
Yeah.
Yeah, I mean, it's like natural disasters. We know it's could happen, but we we don't until it does. And then we go, oh my God, I forgot I should have had batteries or all these other things. But I think that's the flip of the script a little bit is that so somebody has a differencing of opinion than what I am more comfortable with. That doesn't mean that they don't have value, just might not be my values and my beliefs. But maybe this is an opportunity for me to understand better so that I can learn those nuances so that I can better develop strategy so that I can navigate through this. And then I learned something, maybe not what I thought I'd learn, but it helps me build a better understanding. And I think that's what we got to focus on is, during COVID, we all learned certain things. But I got to be honest, many agencies, states, government, communities fell back to the pre-COVID behaviors because it was easy. And so, did we learn anything? And so, I think for me in this period, I'm trying to be like, okay, what is it that I need to learn that will help me be better for my community on the other end in 3 years or whatever it is, right?
Yeah,
So,
you because I was going to transition us to, buckle in and, as you mentioned, like past 6 years and COVID, which is 5 years ago now.
Mm.
To buckle up and, unfortunately, let's go back in time and think about what during that time frame, what was it that, the effects of that socially, economically, and emotionally had really changed a lot of our culture and society during that time frame. But for you in particular, so to the panelists, how did COVID-19 affect you and your work when it first spread? And then what were the effects do you see of the pandemic today? And Sharon, you kind of went into it about how you feel like a lot of the areas of work even though there were changes, you felt that they reverted back. Calvin, I wanted to give you a chance to.
Yeah, happy to take that one. So I can kind of take it from both hats.
Yeah.
Both current organization and my previous work. So for our organization, like I mentioned, was built out of the pandemic because of the rise in anti-Asian hate we're seeing. So obviously, with that rise in anti-Asian hate, there was a need there to kind of address what we were seeing in our communities to bring awareness to that. I think now that we're 5 years out from it, I think that a lot of folks' awareness of it as an important issue has gone down. But as we know that it's, racism was a thing before the pandemic and it's still a thing after the pandemic. And so being able to continue to bring awareness to that. When I was on the Hill, it was during, I worked there for a long time, but during the pandemic, it was a really interesting time because I think a lot of people, we were not prepared to have to figure out where we were going to get PPE for our constituents or just kind of help businesses rebuild. So it was a really interesting time that, as Sherry mentioned, coming out of that, I don't know if we've learned the lessons from how we're going to deal with another one. 'Cause another one, not to scare everybody, but I think everyone's aware another one's going to happen, and we don't have a super functioning CDC or other public health organizations here. So I think there's just a lot to be learned out of it. I think we'll also mention one last thing. I think in terms of public policy and policy making, something that has been a benefit coming out of the pandemic that I found working on the Hill, but even now is before the only folks who had access to lawmakers are ones who could fly out to DC and meet with them. They meet a little bit in the district, but the ones who really had the influence are the ones who are able to fly out to DC, meet with them in person. I think because of the pandemic, Zoom and other methods, now more folks are able to contact their legislators, contact staff. And so I think it's given policymakers a little bit of a bigger lens on the impacts that their work is doing and being able to speak to more people. So I think that we talked about silver linings earlier. I think a very small silver lining of the pandemic is I think it's broadened who's been able to contact and work through the policy making process.
Yeah. When I was experiencing COVID-19, I was in college still, so at a little bit different point in my life. But remembering like the ability to not connect with community, like Sherry was talking about earlier. I think when COVID-19 was happening, my boss was, along with Congresswoman Meng, who's now the current chair of CAPAC, was really instrumental in helping lead and eventually push the COVID-19 Hate Crimes Act, which helped the Department of Justice, in large part with Stop AAPI Hate, which helped the Department of Justice, was a bill that, and then law that mandated the Department of Justice track Asian American hate crimes, disaggregate data accordingly, because like Rita was mentioning earlier, if you don't have the data to be able to make your arguments, then there is no, like, the conversation can't even get started if we can't even start to put numbers to things. I think, what was coming to mind when Sherry was talking and when Kelvin was talking was, I think one thing that we did see during the pandemic, especially with BLM happening at the same time as, unfortunately, anti-Asian hate, was the strong coalition of multi-ethnic coalition of people coming together to recognize the systemic inequalities that were existing within our system and wanting to come together in community. Like we were talking about earlier, people are always interested in supporting their own community, whatever they might look like, to come together in community, to speak as one voice about why these systems are broken and how we can work together to fix them. I think that what's at top of mind right now for me, especially working in Rep. Chu's office and myself being from Los Angeles, is everything that's happening in Los Angeles right now with the immigration raids and protests and the National Guard being called in. And to a certain extent, I feel like sometimes I do see these really beautiful moments of solidarity with people, but sometimes I feel like that solidarity is lost to a certain extent, especially in the immigration conversation. I think that, Asian Americans are immigrants by definition, in that either you yourself or someone in your lineage was likely an immigrant. Native Hawaiians is slightly different, obviously, history there, but for Asian Americans, that is within our lineage. And I feel like in a lot of conversations, we often get left out of the immigration conversation for a lot of different reasons. But I think, in Los Angeles, I've been able to see really strong community coming together in support once again. And also, unfortunately, some instances where it hasn't been the same sense of solidarity, because a lot of the protests have been in the Little Tokyo region of Los Angeles, which was a place where Japanese Americans came back to after internment. And now we see graffiti on the walls telling them to go back to where they came from, or people vandalizing these Japanese American small businesses. When, you know, if anything, these are folks who truly do relate to a lot of the detention experiences that are currently occurring. And so that is one fear that I have myself, is how can we make sure that, you know, we're keeping our Asian American community together, but we're also, you know, continuing to build community in a larger sense with a coalition of partners and leaders and voices from across the country. And only together can we really overcome what these next 3.5 years are going to look like.
And Amanda, you said that you were in college during COVID, and so although I'm very far removed, I have young sisters who, one is currently in college and one had been in college during COVID-19. And something I want to share in perspective is that as a student organizer, I've always been connected to CASU, which is the East Coast Asian American Student Union, and even today I still try to advise informally. Something I saw during COVID was, yes, a lot of these students did not have the opportunity to meet in person, or if they did, it was a different way of, you know, of the vibes were off, okay? Like meeting up with people, you were just like, oh, okay, like, are we gonna get sick? Are we okay to meet? But what I saw was, because of Stop AAPI Hate, a lot of the movement to have the conversations about AAPI history, AANHPI history was on the forefront for a lot of Asian American students, as well as non-Asian American students in that time frame. And I thought that was a really great way to see how many of the students are embracing and learning more about this history. The con was, because of the inability to work together in person, student organizing or passing on the legacy or baton had been a little bit difficult. But I have to say, organizing virtually also worked out too, but it was a lot of burnout with a lot of screen time and Zoom calls. And so I know last week there was a question or a comment from someone that had said that when it came to the pressures of feeling like the youth is the answer to everything that we're facing right now. I know a lot of the comments on that was that we're in it together. We're not just trying to pass it off and say, all right, this is your issue now to resolve. And so I hope that, you know, part of this conversation is that you're seeing people here of all, you know, backgrounds and ages and demographics. We're here to not only pass on this knowledge, but we're here to make it happen with you. So prepare those questions. Turning back to the panel, I do want to get your perspective on, you know, from what you're hearing from your constituents and your communities across the country, what, in your opinion, is one of the pressing issues right now and of concern for the AANHPI community? How do you feel like is the best way to address these concerns? And I'll turn to Sherry.
I'm quiet because I'm thinking, you know, I think people don't know what is a priority. I think there's a lot of confusion. I think there's a lot of fear. There's a lot of, I think, putting on blinders and just keep moving forward seems to be what is happening in communities. Because they're still going to be around, right? Whatever happens 2,000 miles away from them, 4,000 miles away from them, they still gotta get up, go to work, provide for their family, be present, you know, all of those things. Those people are just got the put on the blinders and keep doing. So when I think about pressing issues, I think it really is dependent on who you're talking to, because depending on where your community is. So, you know, in Hawaii, we're still dealing with the Maui wildfires.
Yep.
And the after effects of that has not gone away. But we still gotta, right, welcome tourists and have all of that because that's our economic driver. But then we also struggle with food insecurities. We have struggles with all kinds of stuff around cultural identity, around what does that look like? And so there's so many layers to what people are trying to manage that sometimes they just got to shut off certain pieces because it's too much. And so I think for us in these spaces of public policy, of engagement, it's your code switching, right? Is that the new buzzword, trending word? You shut it off and you turn on the next light. You're walking into different rooms, shutting off the light, turning on the light, and dealing with what's right in front of you. I don't think we, unfortunately, have the luxury right now of a lot of pre-planning because we're too busy bumping from room to room, from place to place, from stories to stories that our community has. And they're so different, all very important. And not that it wasn't before this time, that it wasn't during COVID, but it seems like things are super intensified. And so I think when I think of what's on people's minds, what's on the radars, it depends who you're talking to. And then the biggest one that I see that I don't know if we talk enough about is how do people decompress when, when they're exposed to so much? And as people, we tend to carry things that we don't need to be carrying, but we carry it. And so how do we really have conversations about that without feeling guilty, without feeling like, no, we still got to keep moving and fighting because it's not right. So I think for me, it depends who you're talking to and what is their issue, because there's plenty and the list keeps growing because we find new things that we didn't know we were challenged with. And it's exhausting. I just got to be real. It's exhausting.
Oh, it's exhausting. Um, and for the people who might be interested in having that energy and that capacity to do advocate on these issues or empowering other people's stories, what are some actions that you think could be something, I don't want to say easy, I don't want to say easily taken, but something that they could do if they had the capacity?
I think, I hear it a lot with our congressional members. They always say, speak up, say your story, share your story. I think we use social media. I think that's also a really great venue for people to just talk about it. But again, right, you're going to have the Monday morning quarterbacks who are giving you all kinds of like crappy whatevers. And so you're going to have to get some thick skin. But I think it's finding networks in your area that you can be part of and elevate and also get your own bucket refilled. I think it's that. It's finding those spaces, coming to things like this where you go, oh, really? Wow. And to network and to know you're not the only one, right? So I think that's really important. And I gotta say, I'm so sorry. I need to jump off. And I know you guys are going to have a wonderful other hour with the rest of the panelists. And again, if you guys have questions or want to reach out, please, get my contact from the folks there.
Thank you, Sherry.
Thank you.
Amanda, I wanted to specifically touch upon the immigration conversation that you brought up. And would you say, I mean, obviously with LA, I think it is the most pressing thing currently. And so what are things that people maybe in this audience could do to advocate or help support in that work?
Yeah, I think two things, like Sherry's comments brought up a couple of things for me is like, one, yes, immigration. I will also mention that for our office in particular, as I'm sure everyone here is aware, Los Angeles experienced really significant wildfires early this year. And one of those wildfires, the Eden Fire, was primarily in the Congresswoman's district. So 10,000 homes burned to the ground, people literally leaving with absolutely nothing in their nothing except what was in their car, or people not even getting the evacuation order in time and leaving with literally the clothes on their back and their cat in their vehicle. So I think that, you know, obviously, all of the stuff that the administration continues to put out is top of priority for our office, but we also have this long-term struggle of recovery for these wildfire victims that we're thinking about, and some of them are Asian American, and we found that those with you know, who are Asian American oftentimes have limited English proficiency and so are less likely to seek the services from, and now because of all the immigration stuff, are fearful of seeking the federal resources from FEMA, from the Small Business Administration to help them rebuild. And so, and then imagine you're cutting their healthcare as well. So now you don't have a home, you barely have the stuff on your back, and you're about to lose your health insurance, right? So there's a compounding of issues that is occurring specifically in our district. And I always have to mention that when I'm talking about, you know, what are the priorities of the Congresswoman this year? I think, you know, for the immigration, and then one other thing I'll mention that Sherry kind of said, and I can use immigration as an example, is something that the Congresswoman adopts that I've now started to adopt, because I think it's just a great mindset, is this problem solution mindset. And we start with the problem. So what is happening on the ground? What are our constituents saying? Which is exactly how you framed your question, right? What are the people, what are community organizations, what are the people on the ground saying is the problem? Because us working in DC, especially for a California member, we obviously are in touch every single day with our district staff, we're in touch with community organizations all the time, but there is a certain level of physical distance and to a certain extent mental distance that occurs because we are just not on the ground in the same way. So identifying that problem before arriving at the solution, instead of thinking, what is the grand policy idea that I have to fix this issue? You know, what does community really want to begin with? And then constructing the solution based on that problem. So I think when we look at immigration, right, something that, like a very tangible example I can give is, there is a detention facility close to our district where a lot of the members, community members from our district are being held called Adelanto. It's a immigration detention center run by a private prison corporation. We heard community stories on the ground that there are people being brought to this detention center. So the Congresswoman hears this. She says, I'm going to go to Adelanto, which members of Congress have the ability to go conduct federal oversight to any of these detention centers. You're supposed to be able to let them in. She went last week. They did not let her in. They literally locked the chain door in front of her. And so we obviously caused a big stir about it. She went back yesterday and was able to be let into the facility and saw for herself the conditions of these people in the facilities, right? Of people not being able to change clothes for 10 days, of people not being able to have access to their attorney, of people not being able to contact family members not even knowing if their loved ones are in there. So I think that's right, a very clear example of problem solution. And she's obviously taking it to the level of a legislature, but that doesn't mean that you as an individual can't take that in your own community. I think like problem, my friend, my family member can't fully understand the social security document. They can't understand how to apply for disaster aid. How can I help them navigate this process? Because it's complicated enough to navigate applying for social security if you speak English, let alone if you don't speak the language, right? My family member needs help with X, Y. So you can take this problem solution mindset at a smaller scale, identify what you're seeing in your community, and then think about yourself, you know, what are the solutions that you can take, or what are the solutions that you can enlist other folks to take in order to, you know, feel like you're giving back in a way that's meaningful to you and also personal to you.
And Calvin, you touched upon this, you know, with the conversation about COVID and how racism, as we saw, reared its ugly head. It was always there, but it was very much on the forefront as we saw certain comments being made and people taking horrific, you know, actions and hurting others. And now where we sit, I do think, you know, we haven't solved racism or we haven't gotten rid of racism. So, you know, since your organization is Stop AAPI Hate, what is the next step, or what is it that you're hearing that, you know, could be a takeaway for this group here to take action on?
Yeah, I mean, I think it's obviously something that we're still dealing with. As I mentioned, we're doing a lot of work kind of in the immigration space, trying to link anti-immigrant hate as a form of anti-Asian hate. So I think there's a lot of work we're trying to do there to kind of bring the linkage there and, you know, support our community, since that's as Amanda mentioned, that's like our community got here. So working to advocate on behalf of immigrants. I will say, I think that one way to get engaged with an organization like Stop API Hate. We have a monthly town hall where we talk about various issues. We had one on, the pending travel ban. We've done other ones, talking about birthright citizenship, which is a big issue for the Asian American community. Having worked on the Hill, and I know that Amanda's not gonna love this, call your member of Congress. It matters, it definitely matters, particularly if you're able to bring a personal story to it or tell about how it impacts, they take note of that and it gets to the member on when folks are calling in about, so I think just continuing to stay engaged. The last thing I'll just mention, I think that it's come up, I think, by a bunch of people is, people are exhausted. I think and that is some of, unfortunately, what is the intent of the powers that be is to go after healthcare, go after immigration, go after this and just get people broken down to the point of apathy where they're like, I can't do anything. I'm not gonna be able to make a difference. And so it is a lot. So take care of yourselves, but I think there's an important work that everyone can do and sharing their voice and using the rights they have.
So I do have one or two other questions, but I do want to turn it, to people who are here in the room and virtual. Thank you for joining us virtually. And before we transition into that, I do want to do another commercial break. I had to rush earlier, but I do want to share again this really great resource, especially because this is a panel on public policy. And I don't want, people to come away from this not knowing a lot more of the resources that are available, since it is such a big conversation to have that I didn't think an hour or an hour and a half is enough. And so this 75-page document, which was, again, from CAPA, which is the National Council of Asian Pacific Americans, it has a 100-day review for AANHPI community. So please, if you are very interested in any of the topics, so quickly is they have immigration, health, education, housing and economic environment, as well as other topics that are very well detailed about the history of where AANHPI communities have shown up and fought for our rights, as well as the details of where we're at now and what we need to do further. So again, I know this panel is too short sometimes, but definitely want to bring that up again. And those virtually who are joining maybe a little later. And so, any questions from the audience? Yes.
Hi, I have questions specifically for Helen, but definitely open to the whole panel. Or whoever's like. Experience working both as a staffer and then now as a, more in the nonprofit space, how you found both positions to be as far as affecting the change that we see needs to be made. What are the strengths in each position? What have you taken away? Which one has felt more impactful? Or maybe that's not the right question, but how did you experience those two?
Yeah, no, that's a great question. I appreciate that. I think that there is definitely working on the Hill. It is a lot. It is definitely a place that's run by young people, despite the members of Congress getting older and older. The staff is still young, but I think it's a really rewarding experience. It is long hours for not a lot of pay, but I think you get the opportunity to work with a lot of really great people. And if you're on a team where you have a really good connection with your district office, your district staff to really know what's happening in the district and how folks are being impacted, I think there's a lot of opportunity to make a difference. I mean, I think it depends on what office you're in and who's in power, depending on when you're able to make change at a certain time. But I think it's like a really rewarding experience to do stuff. Now being on the outside, I will say that, again, I think depending on where your org is and who your allies are, and again, where they are in terms of power, can make it difficult to make change at times. But I think it's an opportunity to, again, bring your personal perspective, where how you grew up, your background, and being able to apply that. So I think there's pros and cons to both. But I think regardless of where you may end up, I think doing something related to giving back to community and public service, I think you'll find rewarding regardless of what that is.
Yeah. And offices on the Hill really do work in tandem with the groups to be able to get things done, and the groups work with offices to be able to get things done. if Stop AAPI Hate has a bill idea, they'll go to different offices to try to see which member might be interested, or if a member has a bill idea that they want to include more co-sponsors on, they'll go to different organizations to try to encourage them to help move it across the finish line. So it really is like a tandem relationship. Like, you don't have to necessarily, just because Kelvin's no longer on the Hill doesn't mean that he doesn't meet with Hill staffers or email Hill staffers. I'm on the receiving end of some of those emails, but.
Over here.
Yeah, I really like the comment earlier that policy isn't politics, but I just think like realistically, given how politicized good policy has become and just how hyper-partisan everything is, it's like, I feel like it can be kind of demotivating to see like things that should be or ought to be bipartisan get shut down kind of like from the get-go. So I guess like given your work, like how do you kind of see, like, has your strategy changed to get things done? Or like, what changes do you think need to happen in the policy making space so that things can get done that are just like broadly beneficial?
I told you, they have great questions.
Yeah, that's a good question. I mean, I think that like sometimes politics has to be kind of the means to the end to get to a good policy. And so I think some of that is how you communicate how that policy is going to impact people. But yeah, I mean, I think it is a really interesting time in this country where we're very divided, and I think this mentioned that we're going to talk about kind of the impact at the state level, but also the national level. Obviously, there's things happening at the national level. But I think the states, you're seeing states go in two different directions, and you're seeing different policies in states. And so it's, what's happening in California with, having healthcare for folks of low income immigrants, regardless of their status. But then you've got states like Texas who are denying immigrants of certain statuses from owning or even renting. So I think it's a really interesting divide, an unfortunate divide we're seeing in this country. But I think, like you said, politics kind of colors everything that we do. And so I think it's unfortunately those that are making the policy decisions are politicians. So it is tough.
Yeah, I think that like the language component is really interesting. Kelvin brought up, like, I think about one of the issues that our office is thinking a lot about is language access and how to like separate that from DEI necessarily, like how to make language access something that can be separated from this notion of like anti-DEI wokeness, because language access to us is like something that should be a civil right, and it's something that obviously really affects the Asian American community. I obviously cover like the Asian American civil rights portfolio, but I also cover other portfolios where we do find bipartisan things that maybe not be as shiny or exciting to people, but to find those opportunities to connect with people across the aisle. Like one of the bills that my boss has is to create for simplified terms, is to create a museum of women's history on the Smithsonian, on the National Mall. And that's a bipartisan bill, even though you might think that it might not be at this point in time. So still finding those moment connections. Or I cover animal rights, and almost all of the animal rights bills are bipartisan work, right? So finding those opportunities to connect where you can. And then similarly, when you are able to connect, build the relationship with those staffers, to see them as human beings and to not, it's hard, but to see them as human beings and not necessarily their boss's voice 100% of the time.
And, I don't specifically work on public policy or a lot of the advocacy work at AARP, but from at least my knowledge that the public is aware of is that Social Security is a very popular program. It's turning 90 this year. And so earlier this year, when it was looking like that, that there might be, situations where it could be dismantled or gotten rid of, AARP, one of the leading advocacy organizations, fought to keep Social Security in a way by continuing talking to those officials, making their cases known and making stories known. And so we did have an email campaign where we had, I think in the first week or two, it was like 2 million different emails being sent out to officials and the constant calling in and the stories of the media being able to pick up that, there was longer wait times for people who are simply just trying to make sure that they get the check that they paid into the system. It's not a handout. We all are paying into it. And so, something that's largely very popular, and putting the pressure on certain individuals to make sure that they're aware that their constituents are also seeing this as an important issue. And so, there's no, unfortunately, I don't think there's a very straight answer, but I think the more that we can empower the people to find avenues to be present, to be in front of the people who are making these votes on our behalf, the more that we can actually maybe change what we're seeing. A question in the back?
My question is kind of broad.
Yeah.
But kind of going off of what Layla said over there, how policies becoming like really politicized. I guess what are your thoughts on how the media has evolved and how it's continued to affect politics? Because like you mentioned earlier, even though our representatives might be really old, there's a lot of young people up on the Hill. And I feel like we're in a generation where like my mom might be on Facebook reading something crazy, and my cousin might be on like YouTube Reels and watching another crazy thing. And like, what are your thoughts on like how the evolution of media and like artificial intelligence can like affect, I guess, the vibes of it?
I think that, this last election cycle taught a lot of politicians and both parties a lot of lessons about how to best connect with people in general when it comes to politics. I think that, some of the lessons that our office thinks about, or you see like all the members of Congress now being a lot more active in terms of like direct to camera videos, on short videos, going on podcasts, working with influencers. So I think they're trying to like take the lessons that pollsters, if you will, say that they are. I think there is definitely like a gap. Like I see it between myself and my parents and the interns even in our office and how we all consume media. And I don't think that, that's gonna go away necessarily. I think that is the situation of our media landscape now, is that it is so sectioned off. And so one of the things that, my boss is really interested in is like hyper targeting things. So like if we are doing something related to Asian American issues, how can we make sure that we're speaking to the Asian American community? How can we make sure that we're working with trusted voices in the community, whether that be community organizations or like an influencer, to like make sure that our story is told to the people that need to hear it the most. And so I think that's kind of like one way that we're thinking about it, is like, what is the message that's going to resonate the most with this group of people? Because I'm sure a lot of you guys have like seen that like bubble chart that shows like how like liberal media has X amount of followers and conservative media has X amount of followers. So knowing that, we might not win it by going to one centralized voice, maybe we can perhaps win our messaging strategy by going to a bunch of smaller pockets of people, to bring them, to explain to them, why we think this policy is good for them, if that makes sense.
Oh, and Hannah, are there any questions from virtual audience?
No questions so
Okay.
far, so we can continue with
Okay.
that in person.
So I saw your hand up first and then hand. So we got 3 in a row.
Hi, yeah, thank you so much for being here today and donating your time, and what's definitely a busy time. For everyone, my question's mostly like, since both of you have worked on the Hill, how you've dealt with conflicts within your party or within a specific kind of group on the Hill. So I'm from St. Louis, and we've been subjected to like a lot of ICE raids in the past months, weeks, including in Asian American supermarkets, restaurants, etc. And what was formerly Corey Bush's district is now Wesley Bell's district. And despite kind of overwhelming devastation on the ground with ICE, he recently voted in favor of a House resolution expressing gratitude to ICE. So there's kind of this huge disconnect, I think, at times between where people stand, where elected stand, and where a party as a whole stands, especially with Wesley Bell as a Democrat. So especially like since representatives you've worked for have been in positions of leadership within the House and in Congress, how have you kind of navigated this?
Let's just stay out of trouble. and take this
Please.
question. I mean, I think it's tricky, and I think that, and I will just kind of speak having worked for a Democratic member, I think. The Democratic Party prides itself on being a big tent, so I think that there are a lot of different issues that, like you mentioned, where there should hopefully be more consensus. Unfortunately, folks stray away from that, whereas I think the other side is very much, they keep their folks in line and are very kind of singular minded in a lot of stuff. So I think it is difficult, but I think that being able to kind of have that broader coalition gives Democrats the opportunity to get stuff accomplished. But I think the opportunity to like stay engaged and being able to talk to your members of Congress and reach out to them and have a voice and working through organizations and community groups is a really good way to get in front of them and continue to bring that voice. But it is an uphill climb, I think, because there's obviously a lot of other interests at play, unfortunately, when they're taking votes like that.
I think also like, just because it's one way now doesn't mean it has to be that way forever. The issue that comes to mind is like reproductive rights. I think the Democratic Party is now very firmly in alignment with where their stance is on that being pro-choice. If you had looked at it 5 years ago or 10 years ago, that's not necessarily the case, right? Like there was a lot of movement that happened to get the party to a place where it has, I think, like a very clear, generally speaking, everyone's on board stance. So that's the only other thing I would add, is just because it's that way now doesn't necessarily mean it has to be, and the staying engaged part is the way to move it to the place where you want it to be.
This is, I'll say a question for everyone, hopefully, but just like Kelvin, because we're working that you do. I really like, what's her name earlier? I forgot. She was on the Zoom call.
Sherry.
Sherry. I really liked her kind of like more about the thoughtful approach to like public service, how she was like a passion and a vision. But I think there's also like a very much kind of like individual experience and how people may experience different issues. But generally in the work that you do, how do you kind of like make others, even though their experience is not the same within each issue, how do you kind of get them to, say, for example, with Asian hate, how do you get, people who are not necessarily Asian, or how do you, even in the immigration community or immigrant community, everyone experiences the problem that is going on right now differently. How do you kind of get them to come to a, not necessarily consensus, because you can get into the danger of like essentializing the experience, but how do you get everyone to kind of coalesce more or less against the kind of larger issue?
Yeah, that's a good one. I can start with that. I mean, I think for Stop API hate, I mean, we really try to approach it from kind of a non-carceral response to it. I think that there are a lot of like members of our own communities who there's, elders being attacked or something that, want to follow up with a law enforcement response. But I think we are really focused on building community resilience, building community healing after an incident like that. And I think it's kind of bringing communities together, doing through a cross-racial solidarity and trying to make the community a better place where folks can feel welcomed. But I think that Amanda had mentioned the COVID-19 Hate Crimes Act. Out of that bill, there was also funding that was included that was to address kind of hate writ large. I think there was specific funding for the Asian American community, but there were funding in there for other communities of color, for other faith and religious communities, because they've also experienced it. So I think kind of building those broader coalitions that like at a moment in time, there was a rise in anti-Asian hate, but like we mentioned, that hate's been around and continues to remain around. So kind of coming together around, we kind of need to address hate in all its forms.
I think we'll just have one last question.
Thank you guys for being here. My question is kind of, basically most of the time when I've worked on policy, there's been like, kind of like a disconnect between like policy. People who work on advocacy for the policy and then the people who like organize and mobilize communities for the policy. So I guess my question is, how do you navigate those like three different roles and like make sure people are kind of on the same page?
I think that there's like, in an ideal world, we would get everyone on the same page, but at the same time, not everyone will be 100% happy with 100% of the things that you do. And so I think it's thinking about when we're introducing X bill, who are the trusted voices for that specific issue? And how can we make sure that we're including them and that they, like, because at this point, there's so much diversity in a lot of the different groups, like, how are we making sure that we're being strategic about like, what are our trusted voices in the field at this point in time? I think that like, in terms of how, I think there's a role for organizers, I think there's a role for advocacy, and I think there's a role for lawmakers. And like you said, like, it's really important that all three are working together. And the way that a lot of that happens is through storytelling, which is what we mentioned earlier, in uplifting the stories from constituents and bringing those to the lawmakers so they can make the microphone even louder and use their voice to get it on national news, if you will, versus someone and elevating someone's like individual TikTok video to, you know, a national stage. So I think that's like one way that we can think about bringing everyone together. I also think that, you know, it's a two-way street of making sure that, you know, community organizers are willing to talk to lawmakers, and that lawmakers are willing to talk to community organizers, and to create this like healthy dialogue between the two in a way that doesn't necessarily automatically start blowing up right away. Like, how can we make sure that we're having an actual conversation about it versus just because ultimately, like everyone said, we want the same things for our community. So how can we make sure that we're having a like fruitful conversation about it? I don't have like all the answers on that. I think I'm like still thinking through that. But I know that when I get to go back to the district in our community, it's really important. That's like a really important and grounding time for me personally. And I know that for the Congresswoman herself, she is like a member that goes back every single weekend, which some California members don't always do. So I know it's like also very important for her to like be in community and to stay in touch with folks on the ground. So I think that's at least step one in how to find that type of connection between everyone.
Yeah, I mean, I think I would just really just echo, I think making sure that there's space for a healthy dialogue, that, you know, if there's something that the elected official does that you agree with, I think maybe not right off the bat going out there and yelling about how bad they're doing, but maybe trying to find opportunity to say, here's where our concerns with them are. But I think if those start to build up, you know, they are up for election at certain points and you can make that decision. But I think making sure that healthy dialogue is there to have a line of communication for kind of coming together in consensus and stuff.
Yeah, and like on a staff level, we meet with like almost, if you ask for a meeting, it's very, very rare. I feel like that staff will say no to a meeting,
Yeah.
Right? So it's like, I feel like people are like, well, they're not accessible. So like, yes, the member themselves might not be accessible, but like at least their staff is, and as staff members, we basically have to take the meeting. It's part of our job. So I think there is like opportunities for healthy dialogue that can exist.
So I have one last question to the panelists, and I have Sherry to thank for this question because it's about, you know, decompressing and centering yourself. So before and or after you start crashing out, like what is something that you could like, you know, you do to get yourself back to the center or just to relax?
That's a good question.
Please don't tell me you do nothing.
No, I think I think my Goodreads will tell you it's been a very reading heavy year. To kind of decompress. This actually came up on a staff call we had earlier today.
What are you reading?
Lots of things. Definitely there's been an increase in romanticy this year. I think we had a very good conversation in our staff meeting about fourth wing and all the stuff tied with that. I think just like trying to find an escape is important to kind of decompress and stay away from it. But I think when you're doing work like service, I think knowing what your core values are, why you're doing it, bringing it back to your lived experience or experiences of others, I think is important. So being able to find escaping, but then also being able to return to that grounding is key too.
Yeah, I think the escape is important for, I don't know if this is healthy or not, but I feel like I just dive deeper into community. Like I am someone who's always been like the mom of my friend group, or like someone who likes to host things. So like I host a lot of like dinner things for my friends, just for us to like chit and chat and not talk about work or politics or anything. I host monthly mahjong, which
Mhm.
everyone's invited to if you would like to come. It's this Sunday at the boardroom in DuPont.
Oh.
But yeah, like I think just like finding time to like be joyful with friends and get off my phone.
Mhm.
And
Yeah, and
Have-
I'm similar that I like to gather people or, hop on to someone else's plan if they invite me, But I also, this is when I veg out, is like, I'm like turning on the TV, watching a TV show. I've gotten to the point where I'm like going back in time to be like, what are the TV shows I missed that are like really popular? So like I watched like The Sopranos on binge. Right now I'm like caught up on Upload, which is a really cool like sci-fi, not fictional storyline, but yeah, I mean, and I purposely wanted to point out like crashing out, like I know like it's like, oh, you don't want to be like burnt out or like the negative side of the energy and all that, but sometimes it just needs to be released. But recognize that, hopefully you have things to get you back, or like you have your friends and family that can center you and bring you to where your peace is. But I think, sometimes, yeah, you gotta crash out sometimes. But yeah, so on that note. Y'all, okay, I would like to turn it back to our lovely host.
That was an amazing conversation and your questions like were really, really on point. So thank you, everyone. Thank you, June, Sherry, Amanda, Rita, and Alvin for your thoughtful conversation. And all of those who are joining us virtually, thank you for joining us as well. If you enjoyed this session of WLP, we have, I think, three more sessions. Yeah, 3 more sessions this summer. They are every Wednesday evening, except for June 10th, which we're pushing it to a Thursday. Otherwise, it's every Wednesday evening. We kickstart with a dinner, and then, as you've just experienced a lovely conversation. The next topic is building career to burnout. We'll continue this conversation, mental health and self-care, and it's on June 25th. And we'll focus on topics such as burnout, finding strength, leaning on community, and how to take care of one's mental health while navigating their career. So you can register on our website at capal.org and view all of our upcoming events for this summer and also later in the year. Also, please follow us on social media and learn more about our S&I program at CAPAL DC. And thank you to our 2025 sponsors for continued support, especially the DC Mayor's Office, Moapia. And good night. And there is still more dinner. So if anybody wants to get seconds or grab a little plate to take home for lunch tomorrow, feel free to do that. And thank you for joining us tonight. For a little bit longer, so you are welcome to network and mingle, and as we kind of like wrap up here.